My name is Matt Cebulski. I am with Ionia Behavioral Insights, and I want to talk to you a little today about using Alexa to reduce readmissions with COPD, which is chronic obstructive pulmonary disease. I came up from the Gulf Shores today in Alabama, and my community was so excited they sent me here with a guinea and rooster feather bow tie for your viewing pleasure, so please enjoy while I present. So let's talk about, oh, here we go. It's a little slow, guys, I'm sorry. There we go, okay. So the impact that Alexa is going to make on healthcare is massive. We think at Ionia that this is the harbinger of change for how healthcare is going to be delivered worldwide, specifically with COPD, which is our first foray here into this disease management. So let's go over a little bit of environmental rules about what's going on in healthcare right now. There's a shortage of providers. There's an increased amount of people who are sick and that need access. We have a focus now on quality tied to reimbursement, meaning that if you get readmitted for a disease, we didn't do our job treating you. Additionally, we also know that consumers, because of modern tech tools, are ready to be interactive and connect with their healthcare provider through digital tools like Alexa or mobile platforms. They're encouraging it, they request it, and they're actively using it. I wish there was a way to go a little faster. Does anyone know any tricks that I don't? Oh, let's try that. Okay, got it. All right, so we also know that they are informed, they're connected, they want to be engaged in their decision making, and they also want convenience. For us, we see Alexa fitting in great with the convenience tool. You know, you need prompts maybe with a text message, you need your voice. That's about it. And the rest of the cascades take care of themselves. This is just more data that shows us that they're ready to be engaged. We also know that they say that using tools like Alexa, using tools like the Apple Watch, has changed their behaviors as chronic condition patients. This is really good news. This means it's ripe time to introduce this to a population like COPDers. They also want a new experience. When you're at home and you don't feel well, it'd be great just to say, look, Alexa, I don't feel well, and be connected to a provider. Speak to that provider, interact with that provider, have meds prescribed for you. On the provider side, be able to talk to Alexa, add notes, histories, and focus on the care of the patient instead of all the ancillary things that go on during a patient visit. Really focus on the healing. When we were developing a prototype for COPD, we had to make a few considerations. One being, why COPD? Well, it's expensive, $10,000 for every readmission. That's 118% more expensive than the initial readmission. 24 million people in the United States have COPD. 10% of people over the age of 40 in China have COPD. It is caused by smoking, which we know has been a massive history in the US as well as the world. We also know that it has a high readmission rate, about 20%. We also wanted to do a few other things, like individualize the care with the patient if we sent them home with an Echo Dot, make it simple, Alexa does that, make it efficient, transparent, and secure. It's nothing unless we really build these cascades with patients utilizing what we know with modern tools of persuasion, influence, nudging, reciprocity, authority. We've all been very familiar with these from the popularity of things like Freakonomics and Malcolm Gladwell. We want to implement this tool using behavioral economics to make these behavior changes in the long run. Ultimately, we don't want to give the patient more information. We don't. We want to give them useful information tailored for them. So the initial features involve sending a patient home with COPD after discharge with an Echo Dot connected to their cell phone. Simple as that. The whole goal of this is that they don't come back to the hospital, but they make follow-up appointments and they manage their care better, and we prevent exacerbations. It's really important. We have emergency protocols, reminders and tracking, how to take your meds, how to clean your meds, incentives for daily use, comparisons to other people. Next-gen ideas we have are connecting them in a professional way for tracking as well as bedside checklists. The business impact is really clear for us. Hypothetically, high amounts of quality, reduction of readmission, connections to other patients, social engagement is the blockbuster drug of the century. It's already being used elsewhere. Boston Children's has it implemented in their burn unit. And we really think that this can create a habituated touch to care, touching patients with fewer providers at their home space in order to change how they take care of themselves daily, reducing the cost, improving their quality of life, and doing it simply. Like I said, Alexa, the harbinger of change when it comes to healthcare. We're excited to be a part of this. Our partners in Boston at Signature Healthcare, and we're looking forward to seeing the results. I'm Matt Cebulski with Ionia. Questions? Thanks.
So is this part of do you fall under the HIPAA?
Yeah,
Do you conform with HIPAA guidelines?
Yeah, we can conform with them. Also, when you look at the FDA, this isn't considered use as a medical device, and it doesn't regulate a medical device. I mean, unless you want to call the patient their own medical device, which ultimately, as a psychologist, I do think that. But no, from what we've discussed, what we've researched, we think that this is kind of skirts by that. Now, I am putting it past an IRB just to get that, get it vetted. You know, I don't want to do anything that's one, unethical, or two, harms anybody. So we want to make sure we avoid that.
And is your protocol, are you using, you're not building any NLU or any independent sort of AI?
We would be building some portals connected to the structure of AWS Lambda in order to accomplish this, and connecting to Twilio, right? Because until recently with the Echo Show, and I think with voice calling that was announced recently, we needed to prompt the patients. So our idea was that if you connected them with a dot and their cell phone through Twilio, we could push a notification to their cell phone, talk to Alexa, tell them how you feel today. Did you take your meds today? Take your med and tell Alexa you've done so. All in the name of connecting them to a provider or a visiting nurse association, which we have actively in the Boston area, so that if they, before exacerbation, they're getting care and they're learning how to take care of themselves.
And so are you just are you passing through the data, or are you interpreting it?
We do some interpretation, but that's next gen really. A deeper dive into that would be looking at how people are interacting with the tool, ages, even credit by credit score, for example, which correlates heavily to education level. So to know where to put resources to keep people healthier and out of the hospital.
Got it. But the basic questions and the protocols are defined by the healthcare provider.
Yeah, there's already protocols for dealing with COPD. Yeah. Really, we would just have to align making sure all the respiratory therapists and all the pulmonologists, when someone comes into the ER and they have a first-time diagnosis with COPD, they go home with this tool. Right now, this hospital system has a 20% readmission rate for COPD. If we can just reduce that 5 to 10%, the average is $10,000 total, but I mean, the median is much higher than that. So there's lots of cost savings here, but beyond the cost savings, there's a huge quality of life increase for these patients. I mean, imagine you can't breathe, can't walk across your living room, and you don't feel well. You can talk to Alexa, be connected to BVNA, the Boston Visiting Nurse Association, and they can talk you out of some anxiety, or they can tell you, you need to take your nebulizer, you need to take this other pill, and you're going to be okay. Or you need to come into the ER.
And what's the state of the product today?
I'm sorry?
What's the status of the product?
We're still in developing the prototype. We're finishing that up. Okay. Yeah.
And the partner is?
Signature Healthcare out of Boston, and I'm also working here with Joe Marks.
Got it. Cool.
Yeah, we're really excited about it. We're also going to be talking to MUSC in Charleston about the tool as well.
Thank you.
Thanks.